Welcome to Healthy Facts 101, your trusted source for practical health tips and support. And today, we're diving into a topic that's incredibly important, but often overlooked: your health and well-being after childbirth. The postpartum period is a unique time of healing, recovery, and major adjustment. While caring for your newborn is a top priority, it's just as crucial to pay attention to your own needs. Unfortunately, many mothers feel pressure to bounce back quickly or put themselves last, but your body needs time and care to recover fully. Remember, your well-being is the foundation of your family's health and happiness. When you take care of yourself, you're better able to care for your loved ones and enjoy these precious moments together. Ignoring your body's signals, like pain, fatigue, or unusual symptoms, can have serious consequences for your recovery. It's important to listen to what your body is telling you and not dismiss any warning signs. In this episode, we'll walk you through 10 postpartum warning signs you must never ignore. These are red flags that mean you should reach out to your doctor right away. Let's get started and empower you to take charge of your health. First up, let's talk about heavy vaginal bleeding, a symptom that can be alarming for any new mother. After giving birth, it's completely normal to experience some bleeding, known as lochia, as your body heals and recovers. However, it's important to know when that bleeding becomes excessive and potentially dangerous. While some bleeding is expected, soaking through more than one maternity pad in an hour, especially if it continues for several hours, is not normal and should be taken seriously. This level of bleeding can quickly lead to significant blood loss. Another red flag is passing blood clots that are larger than a golf ball or an egg. These large clots can indicate that your uterus isn't contracting as it should, which can prevent it from stopping the bleeding effectively. If your uterus isn't contracting properly, it can put you at risk for postpartum hemorrhage, a serious and potentially life-threatening complication. Medical professionals may need to check your abdomen or perform an exam to determine the cause and provide treatment. If you notice these warning signs, don't wait or try to convince yourself it's nothing. Call your doctor or midwife right away, or head straight to the emergency room. Trust your instincts. Your health and safety come first. Remember, you are not alone. Lean on your support system, whether it's your partner, family, or friends, and don't hesitate to ask for help. Your well-being is the top priority, and it's okay to speak up for yourself. Postpartum hemorrhage can develop quickly and become life-threatening if not treated promptly. Acting fast can make all the difference in your recovery and long-term health. Never worry about being a bother or overreacting. You know your body best, and it's essential to be your own advocate when something doesn't feel right. If you can't reach your healthcare provider, don't hesitate. Go directly to the emergency room. Quick action can save your life and ensure you get the care you need. Next, severe abdominal pain. Some cramping is normal, but pain that's intense, persistent, or worsening is not. This could signal a uterine infection, a C-section complication, or even something unrelated like appendicitis. If pain makes it hard to move or care for your baby, don't dismiss it. Trust your instincts. Your body knows the difference between healing and harm. Seek urgent medical evaluation. Don't let anyone downplay your pain. Your recovery matters. Get help if pain feels overwhelming or unusual. A high fever, over 100.4 degrees Celsius, 38 degrees Celsius, is a clear warning sign. Fever after childbirth can mean infection, urinary tract, C-section wound, or breast tissue. Don't just take Tylenol and hope it passes. Call your doctor to find out why you have a fever. Untreated infections can lead to sepsis, which is life-threatening. Always have a thermometer handy. If you feel unwell or chilled, check your temperature. Prompt action can save your life. Pay attention to vaginal discharge. Normal postpartum discharge, lochia, changes color and has a musty, metallic smell. If it becomes foul, fishy, or offensive, that's a sign of infection, especially if you also have fever or pain. Uterine infections need antibiotics and won't clear up on their own. Don't ignore this symptom. Call your healthcare provider right away. Early treatment prevents serious complications. Difficulty breathing or chest pain after birth is a medical emergency. These symptoms could mean a blood clot in your lungs, pulmonary embolism, or a serious heart problem. Shortness of breath, sharp chest pain, or a rapid heart rate. Don't wait. Call 911 or go to the ER immediately. Don't try to explain it away or wait until morning. Your life is at stake. Quick action is critical. Trust your body's alarm bells. Severe headache or vision changes can signal postpartum preeclampsia. This isn't a normal headache, it's intense, persistent, and doesn't improve with medication. Vision changes like seeing spots, blurry vision, or light sensitivity are red flags. You might also notice swelling in your hands or face. Preeclampsia can cause seizures or stroke if untreated. Get your blood pressure checked immediately. Call your doctor or go to urgent care. Don't wait. This needs medical attention. Some swelling is normal, but swelling, pain, redness, or warmth in one leg, especially the calf, can mean a blood clot, DVT. DVT is dangerous because clots can travel to your lungs. If you notice these symptoms, call your doctor right away. Don't massage or apply heat. You may need an ultrasound to check for clots. Quick diagnosis can prevent a medical emergency. Don't ignore one-sided leg symptoms. Occasional nausea is common, but persistent vomiting is not. If you can't keep food or water down, you risk dehydration and serious complications. This can affect your recovery and milk supply. Persistent vomiting could also signal preeclampsia or infection. Call your doctor if vomiting lasts more than a few hours. You may need IV fluids and further evaluation. Don't wait. Your body needs nourishment to heal. The most important warning sign to watch for is having thoughts of harming yourself or your baby. These thoughts can feel terrifying, confusing, and isolating, but it's crucial to remember that you are not alone in experiencing them. Many new mothers struggle with these feelings, even if no one talks about it openly. It can happen to anyone, regardless of background or circumstances. This is not your fault. It's a symptom of postpartum depression, anxiety, or even postpartum psychosis. These are real medical conditions that can affect your thoughts and emotions, and they are not a reflection of your character or your abilities as a mother. You are not alone, and you are not a bad mother. So many women have been where you are right now, and there is no shame in asking for help. Reaching out is a sign of strength, not weakness. These conditions are medical emergencies, just like any physical complication after childbirth. If you had a high fever or severe pain, you would seek help right away. Your mental health deserves the same urgent attention and care. Tell someone you trust about what you're feeling, whether it's a partner, friend, or family member. Call your doctor or reach out to a crisis hotline. There are people who care and want to help you through this. There is help. Therapy, medication, and support are available. You do not have to go through this alone. Don't suffer in silence. Your well-being matters, and recovery is possible with the right support. You deserve recovery, and there is hope even in the darkest moments. Connecting with others who understand can make a world of difference. Please, reach out for help immediately. Your life and your health are important, and there is always a path forward, no matter how hard things may seem right now. Breastfeeding can be uncomfortable, but a painful red swollen area on one breast, especially with fever or flu-like symptoms, can mean mastitis. Mastitis is a breast infection that needs antibiotics. It can develop quickly and make you feel very ill. If untreated, it can lead to an abscess needing surgery. Call your doctor if you notice these symptoms. Early treatment helps you recover faster. Don't ignore severe breast pain or redness. Your comfort and health are important. Remember, your health is the foundation of your family's well-being. Trust your instincts. If something feels wrong, speak up. Don't let anyone dismiss your concerns. Share this video to help others recognize these warning signs. Empowerment comes from knowledge. Thank you for joining Healthy Facts 101. Subscribe for more essential health information. Take care of yourself. Your life matters.